Okay, if you're a parent, you know this feeling. That sudden cry from the other room, right in the middle of the night. Your heart just drops, and so often the culprit is an ear infection. It's stressful, it's confusing, and you're left wondering, what am I supposed to do? Well, today we're going to cut through all that noise. We're going to give you a clear, reassuring explainer based on the latest Dutch medical guidelines that will give you a solid plan.
So here's our roadmap. First, we'll break down what an ear infection actually is. Then we'll cover what you can usually expect to happen, talk about the number one most important first step, tackle that big question about antibiotics, highlight the exact moments when you need to see a doctor, and then we'll wrap it all up with the key things you need to remember. All right, let's get into it.
All right, first things first. Let's get on the same page about what's actually going on in your child's ear when they're screaming in pain. Ugh, that sound. We've all been there, right? It's late, your little one is hurting, and you're just trying to play detective. And yeah, ear infections are incredibly common, but you know what? That doesn't make it any less worrying when it's your kid. Okay, so the fancy medical term is acute otitis media. But what does that even mean? Honestly, it's just an infection and some swelling in that tiny space right behind the eardrum. You know how they get a cold? Well, sometimes the germs from that cold sneak up into the middle ear and bam, you've got an ear infection. The good news is it's almost always a short-term thing. So now we know what it is. But let's talk about the part that really causes all the anxiety. What's going to happen next? Just understanding the typical journey of one of these things can make a world of difference for your own peace of mind. And get ready for this, because this is probably the most reassuring piece of information in this entire explainer. 80%. That number means that for the vast majority of kids, 8 out of 10, their own body is going to fight this thing off and get it under control in just 2 to 3 days. Yep, the worst of the pain and the fever often just goes away on its own without a single drop of antibiotics. So here's what that 80% looks like in real time. Day 1, yeah, that's going to be the worst. That's the peak pain, the peak fever, the peak misery. But, and this is the important part, by day 2 or 3, you should start to see things turn a corner. They start feeling a little better. It means that if you can just get through that really tough first 24 hours, your child's body is already winning the battle. So if your kid's body is doing all the heavy lifting to fight the infection, what's your main job as the parent? Well, according to the guidelines, it's super simple, but it is the most critical thing you can do. Focus on managing their pain. That's it. Your job is to make them comfortable. And the recommended approach is a super clear 2-step plan. Step 1, paracetamol. It's your first choice for both pain and fever. Now, the real key here is to give it at regular, fixed times, like on a schedule. That way you stay ahead of the pain. If that's still not cutting it, and your child is over 3 months old, then you can bring in ibuprofen. Okay, I know what you might be thinking. What about all the other stuff in the medicine cabinet, like a decongestant nose spray? I mean, it makes sense, right? You want to help clear everything out. But is it a good idea? And the guidelines on this are crystal clear, not recommended. It seems logical, but there's just no proof that it actually helps the ear infection itself. Plus, there's a risk of side effects for little kids. So when it comes to ear pain, it's best to just leave this one on the shelf. All right, let's tackle another common one. What about those numbing eardrops? I mean, talk about a direct approach. Put the pain relief right where the pain is. But again, the evidence just isn't there. The guidelines are pretty blunt. The pain-relieving effect of these drops for a middle ear infection just hasn't been proven. So your best bet is still that simple 1-2 punch of oral paracetamol and ibuprofen. All right, let's get to the big one. The question that causes the most confusion and debate for parents: antibiotics. And let me tell you, the way we think about using them for ear infections has changed a lot. Just read that quote. This is a game changer. For most kids, giving them an antibiotic has little to no effect on how long they're sick or how bad they feel. This is exactly why doctors have moved to an approach called watchful waiting. It's all about focusing on comfort first and only using antibiotics when they are truly, truly necessary. Now, this doesn't mean we never use them. There are absolutely times when antibiotics are the right call from day 1. These are the high-risk situations. We're talking about the really little ones, under 6 months old. Or if your child seems severely ill, like super sleepy, hard to wake up, or just getting worse really fast. And of course, kids with certain underlying health conditions will need them right away. Then you've got this sort of maybe zone, where a doctor will talk it over with you. This includes kids under 2 who have infections in both ears, or a child whose eardrum has ruptured and there's fluid coming out along with a fever or pain. And this is a big one. If you've been doing a great job managing the pain for 3 days and your child just is not getting any better.
And that brings us to a really crucial part of the plan, the safety net. You need to know when to stop watching and waiting and when it's time to seek professional medical help immediately.
Okay, this is important, so pay close attention. These are the non-negotiable red flags where you get help right away. A fever in any baby under 1 month old is an emergency, period. If your child seems really sick, super lethargic, hard to wake, drinking less than half of what they normally do, get help. And you need to be aware of the very rare but serious complications like meningitis or mastoiditis, where the ear might be sticking out and painful behind the ear. Look, always trust your gut. If you are worried, make the call. So what happens if the eardrum does pop and the ear starts draining? It sounds awful, but it often brings instant pain relief. It's not an emergency, but you do need to follow up. If it's still draining after a full week, give your doctor a call. If it dries up, you should still make an appointment for about 2 weeks after it started, just so the doctor can take a peek and make sure that little hole has healed up nicely.
Whew, okay, that was a lot of information, I know. So let's boil it all down into the most important points that you can walk away with right now.
So let's put it all together. Here's your new game plan. First, trust your child's body. It's the hero in 8 out of 10 of these cases. Your job is to be the comfort manager-in-chief, armed with a simple pain relief strategy. Think of antibiotics as a special tool, reserved only for those specific, high-risk situations, not as the first thing you reach for. And finally, your most important role of all is to be the lookout, knowing those critical alarm symptoms that tell you it's time to call in for backup.
You know, having a clear plan like this can turn a really stressful, uncertain situation into something you know how to manage. By understanding what's going to happen and knowing exactly what to do, and maybe more importantly, what not to do, you can feel way more confident. And hopefully, that's one less thing for you to worry about in the middle of the night.